Okay, so in the virtual lab we did this week, there was 3 different patients that all had cardiac issues or issues of some sort to do with their heart. And we got to see ultrasounds of the heart, and we got to do echocardiograms, which I guess is the same thing. We did MRIs and we did a pedigree on the patient. So patient A was complaining of syncope, which is loss of consciousness, and he was worried that his pedigree or his family history had a history of heart disease, so he was worried that he was gonna have that too. After I did the auscultation, the results was the heart sound indicated a systolic murmur, and the echocardiogram found that the patient's aorta was increased in size, which indicated an aortic aneurysm. The MRI found that there was no evidence to conclude that there was anything other than the aneurysm in the patient. And the pedigree on the patient was a dominant pattern of inheritance for the disease. And they didn't get an electrocardiogram. And the diagnosis for the patient was Marfan syndrome. So syncope is a factor that was contributing to that. In patient B complained of breathlessness and an erratic heartbeat. He was 35, but he was a dwarf. So the auscultation results were showed that the first and second sound of the heartbeat was abnormal. The echocardiogram showed that the patient was actually missing a wall between the left and the right atria, which is just an atrial septal defect. The patient did not get an MRI, and the lineage, so the pedigree part, supported an autosomal recessive pattern of inheritance, so it was kind of rare for him to get that. And they didn't get an electrocardiogram, and he ended up having Ellis Van Creveld syndrome. So that was interesting. Patient C had complaints of dyspnea and fatigue when they were doing strenuous activity. The patient was 55 and had a normal build, but the heart, after doing the auscultation, the heart showed a diastolic murmur. The echocardiogram showed that the mitral valve was thickened and was not moving properly. The MRI, the patient did not get an MRI. And the pedigree showed that it wasn't inheritable. And the diagnosis in the end showed that the patient had mitral stenosis from rheumatic fever. And this is my chart that I had made after doing the lab. So yeah, that's all of the factors that contributed to those were the complaints, the age, the pedigree, the build of the person plays a role in that, and yeah, that's pretty much it.